Generally, the elderly are at more risk for having more chronic medical problems, but also more severe medical problems. And when we come up with a new treatment plan, they're more likely to have non-compliance with the regimen we prescribe because it's hard to change their routine.
My mother had 3 strokes. I can honestly tell you when she came home from the hospital, she had close to 20 different meds. It was so much.
The patient with chronic diseases may need medications that have to be administered multiple times during the day. We generally offer the patients with a big bottle of a medication, and they need to figure out when and how often they're required to take that medication.
The social worker at the hospital recommended an agency that came to the house and saw what I was doing, and she immediately suggested Mediset. I had no clue of what Mediset is all about.
So she is checking every one of the pills in there to make sure the correct ID is on the medication. This pharmacist here will first look at the orders to see if they see any interactions possible.
And I think that was one of the best decisions I've ever made. Because not only it helped me, I was able to go back to work and be able to put upon my other siblings to help for caring of our mother and make sure that her meds were taken on time and the right ones.
The one thing that is most often needed when they come to this environment is medication assistance. And that is where the staff go and get the medicine, hand it to the resident. And the thing is that we are not allowed to administer.
This is what a patient would take in the morning. So you would have this to where if as many medications are in here, you'd have that many different bottles. So you'd have to try to manage so many bottles compared to just opening this pouch and taking everything out.
And a significant portion of hospital and nursing home readmissions are attributed to medication non-compliance. Studies have shown that about $290 billion costs are added to the U.S. healthcare system annually because of the non-compliance.
When you look at the difference between a skilled facility and assisted living, you're talking maybe $14,000 a month to maybe $4,000 to $7,000 a month. If you take somebody who lives at home and they can still manage at home, but they just need, this Mediset to help them stay independent, then you look at someone who's independent in their home that now might have to go to assisted living, again, their private home, to $4,000 to $7,000 a month. A Mediset allows an untrained person to safely assist with medications for somebody, or someone who's in their own home who gets a Mediset delivered to them. It allows them to possibly maintain some more independence. Many of our residents have changes to their Medisets weekly, sometimes more than once a week. That means that this Mediset program, we would have all of these meds here, and it would essentially, most of those medications would go to waste because they would have to dispose of all of the medications. One example of this is, say someone is prescribed something and they have an allergic reaction to it. I think that it's a valuable service. I think it's one that our industry cannot do without. I think that from a legal standpoint, you would be jeopardizing any of us who are licensed people. Many of the people that come to us may not have families, may not have a lot of resources.
I want to be able to take care of him to his last day, because it's just how we were brought up, that family are important.